Well, thank you, everybody. We're now in the abstract session and we're looking at clinical trials and consent. So my name's Natasha Roberts. I'm a Senior Research Fellow and Conjoint Nurse up here in Brisbane in the Metro North Health Service, and I've got the good fortune of chairing this session. So in the interest of time, we'll just move forward quickly. Our first speaker is Dr. Mark Liu from the University of Queensland, and his presentation is titled Advancing Health Equity in Randomised Controlled Trials, a Collaborative Implementation Science Approach. I'll hand over to you, Mark.
Thanks, Natasha. I just wanted to check my audio is okay. You can hear me?
Yes, absolutely.
Great. Awesome. I'll go ahead and share my presentation. Okay, so you should be seeing my slides now. Okay, just give me one moment as I move some windows around. Okay, great. So good afternoon, everyone. Thanks for joining in online. Thanks for the introduction, Natasha. So yeah, my name is Mark and I work as a researcher in the area of specifically clinical trials. I'm going to be speaking a little bit about some work we've been doing recently in the area of promoting health equity as well as how it overlaps with implementation science. Firstly, just to set the scene, many of you are probably familiar with these research areas already, but just to give a quick snapshot for those who may not be, clinical trials are widely acknowledged in the healthcare research sector as the most rigorous method for answering research questions due to features such as the randomization of participants, having a control group as a comparator, or blinding of participants or assessors, measuring the outcomes to reduce the chance of biases affecting the results. Implementation science is a research field that explores what then is done with the results from healthcare research. How can we best be implementing them from research settings into routine care, as well as sustaining them and scaling them as well? And then bringing in the concept of health equity, thinking about if we have strong healthcare research from randomized trials and we're implementing it, who then is benefiting from the results? For example, commonly research is concentrated in metropolitan areas that are relatively well resourced, so it can be hard to know if it is applicable to other more diverse contexts. For example, if there are people who don't speak English or have lower health or research literacy levels. So it all comes back to the overarching question that I think we'd all like to, explore and look at is the research we do good science? Thinking about whether it is implementable, equitable, and of course, the underpinning ethical principles of all of that as well. Here's a photo of my team that I just wanted to quickly introduce to give some background to my role and my team. So Ultra is the clinical trials capability team based here out of the University of Queensland. We're a group of methodology-focused researchers, rather than trialists focusing on a particular disease or health profession. Our roles are to grow the methodology capabilities of trial teams, including a whole range of different specialties, including quantitative, biostatistics, qualitative and mixed methods research, better consumer and community representation and integration into the trial process, as well as implementation science, which is my area of passion, I guess. So about 6 months ago, we wanted to begin exploring how to promote health equity with a bit of an implementation science lens, without any particular end goal or scope yet. So naturally, we started by reaching out to other local experts and researchers here in Brisbane and in Queensland in the health equity relevant research fields, such as Aboriginal and Torres Strait Islander health, multicultural health, including how we do research with non-English speaking communities or working with interpreters and translation services. Researchers working in regional, rural and remote health, thinking about telehealth and teletrials and decentralized research designs. And building trials and research capacity in non-metropolitan settings. So what began as just conversations with fellow academics and other research professionals quickly expanded and grew as more ideas were raised and talked about. And that led us to speak to over 60 different individuals from a whole variety of backgrounds as well, and how they, sorry, I just lost my train. As well as funders and how they structure their criteria and how concepts of health equity were introduced, as well as ethics committee members and research governance officers about their experiences engaging with researchers, and consumer and community representatives as well, who had lived experiences either participating in trials or working with trial teams to engage with diverse communities. So I think we ended up speaking to over 60 different people here in Queensland, also in other states such as New South Wales, Victoria, South Australia, and the Australian Capital Territory, as well as one lady from Sweden, the Karolinska Institute, that we met through a conference poster earlier this year. So here's just a few dot point examples of some of the themes that kept coming up. It's not an exhaustive list by any means, but just wanted to give you an idea of some of the things that were raised. And of course, different communities or different research fields have their unique considerations, but there were some overarching themes that kept coming up, I guess. Lots of researchers discussed being more critical around their trial eligibility criteria, finding that fine balance between internal and external validity, while keeping in mind the demographic characteristics of the people we're hoping to help with our research. The process of consenting, oftentimes being overbearing in terms of the technical wording or lengthy paperwork, both for the participants as well as the clinical trial teams who are asked to help recruit to trials. How that impacts the recruitment of people who may have some complex social determinants. And then as well, who is accountable? Everyone agrees that it's important to promote health equity, and they intend to try their best within their roles and scope, but thinking to other layers within the system as well. Throughout the trial sector, how do our ethics committees and funders influence researchers' priorities and thinking, as well as other influential positions such as our scientific journal editors or managers or other leaders within universities and health services. So that's where some of the simple implementation science thinking started to occur and could be helpful to be applied, mapping out the different factors and influences to better understand how we can look at these barriers or facilitators to promoting health equity. So we spoke to a bunch of people with experience or passion in different areas that involve health equity. So what then was the next step? A few discussions we had mentioned that it would be good to have an in-person event where researchers and other people from different backgrounds and areas of interest could get together and have a big discussion about all these overarching factors that impact health equity across all clinical trials broadly. We decided to give it a catchy name and went with a think tank style event. A couple of different approaches were raised in terms of how to facilitate an event with such diverse attendees and such a challenging and nuanced topic. A colleague of mine, Beck Jenkinson, who I think presented earlier today, she works with Ultra as well around how to best do consumer and community involvement in trials, suggested that some principles from the World Cafe method would be a good place to start. Without going into too much detail about the method, it essentially involves small group discussions that rotate throughout the day with a focus on creating a hospitable environment so that attendees are comfortable sharing openly, as well as having broad and simple questions to allow for free-flowing discussion that build upon each other as we progressed through the questions. And a second methodology that we drew upon came up when speaking with a consumer representative, Lorraine Tutton, a Gamilaroi Murawari Aboriginal woman who had experience personally engaging with trials, as well as working with academics to coordinate Indigenous health education and engagement here at the University of Queensland. She suggested that some of the World Cafe principles around equal voices, around reducing power imbalance and promoting listening were also mirrored in yarning circles, which is an Australian Indigenous methodology that's centered around storytelling and building relationships through respect. So we took these complementary principles from both these methodologies and endeavored to explore three plain and simple questions. What does health equity mean to you, to the attendees? What factors influence health equity across all the systems and layers? And finally, what might be some of the next steps? Just for the presentation today, I'll be looking at the second question, particularly the discussion around the role of ethics committees. So here was a couple of snippets from the day, which was just earlier this month, the first week of November. On the left is a photo of some of the attendees, and on the right is a screenshot from the graphic recordings that were done on the day by Rachel Alpert from Art Barn. She was making live thematic visualizations of the discussions throughout the day. And this was a visual of some of the factors raised, organized in this onion type model, or I guess some of you might know the socio-ecological model, where there's individual factors relating to the trial participant or clinical and research teams, some inner contextual factors such as our institutes and our universities, as well as some outer conceptual factors such as our societal or political influences. Okay, so focusing on the conversation around the role of ethics committees in promoting health equity in trials, here are some examples of the recurring topics from the day about how researchers were able to increase their awareness around health equity issues and promoting inclusivity in their trials. Ethics committees play a big role in encouraging better practices in consumer and community involvement in the design of the trial research questions, such as the contexts in which the trial will be conducted, or the outcome measures, making sure it's relevant and appropriate to the end users. Specifically, it was important that eligibility criteria, particularly exclusion criteria, was carefully considered. A common example being the blanket exclusion of people who don't speak English. Another example was looking at participant documents, such as your information sheets or consent forms, and any other intervention-related documents, making sure that the readability was suitable and not overly scientific or technical. And for the trial teams themselves, it was a real opportunity to be reflecting on these topics more deeply and building capacity within themselves around how to do trials in a more equitable manner. Many of these interactions with ethics committees were real opportunities for learning on the job in the absence of having formal training around these topics. I also wanted to describe how many of the attendees felt like there were really two different sides of the coin in terms of the experiences in engaging with ethics committees. Many of us may be able to relate to the first one, where it's just a matter of maximizing the efficiency, trying to get the ethics approval as quick as possible to meet project deadlines, which means minimal, meaningful engagement about the actual ethical considerations. But on the other hand, those that had positive experiences described engaging more with their ethics committees, speaking more in person or over the phone proactively and collaborating to make sure the trial methods were more mindful of ethical and equitable considerations rather than just trying to get the ethics done ASAP. Okay, so here were some of the key takeaways that I wanted to share. For the most part, trial teams are really keen to explore how they can better incorporate aspects of health equity in their research. And the ethics application process was highlighted as a key opportunity for them to consider these topics. There's a real desire for deeper and more collaborative engagement, even though many of us admittedly treat ethics applications just as an administrative task. But it is really an opportunity to engage with people with expertise on the committee on how to make our trials more equitable and inclusive. And I guess going back to the idea raised at the beginning, it's all about making sure our research is, I guess, better in general, that the science is impactful. thinking about how we can make sure our trials are recruiting the right diversity of patients to show that it's generalizable to the diversity of Australian communities, as well as testing if it's implementable into real-world healthcare settings outside of research-intensive settings that are already quite well-resourced and well-trained in research methods. So asking the question, can the trial or the intervention be implemented in other settings too, if we wanted to scale it or sustain it? I just wanted to end by saying this is all still an ongoing process. We're still seeking out other experts in the field and wanting to run more events around promoting health equity in trials, both in Queensland as well as interstate. So if you want to be a part of future events or collaborate in any way with our team, please do reach out. We're still in the process of analysing some of the data from the think tank event and coming up with some of the tangible actions as next steps. So there's plenty of opportunity to work together if you're interested or passionate about these topics. You can also quickly just scan the QR code and share your email with us, and that way we can reach out to you as well. And that's it from me. Thanks for listening.
Thanks, Mark. We don't have time for questions, but thank you for your presentation. I'm sure lots of people will be reaching out to you. I know I will be. So thank you very, very much.